They've already received 11 rattlesnake bite calls this month alone, more than double the number at this same time last year. Experts say recent monsoon storms may be playing a role. The cooler temperatures after the rain are bringing more people outside and increasing the chances of an encounter with a rattlesnake. Of the 11 cases reported this month, 9 people were admitted to Banner University Medical Center, Phoenix, within a 3-day period. Dr. Megan Spires is a medical toxicologist with Banner University Medical Center, Phoenix, and she joins us now live. Thanks so much for being here. Wow, I mean, the numbers are astonishing. 9 people in a matter of 3 days. What happened there?
Yeah, that was a lot. I think, really with the monsoons, it's just the cooler temperatures that brings both snakes out and people out. So they're more likely to be, encountering snakes in those conditions.
So the fact that the snakes are out during this cooler weather, I mean, that's not unusual, but that just was highly coincidental that you had 9 people in 3 days.
It was a lot, yeah, and actually we've had a couple more since then.
Wow.
But yeah, the cooler temperatures with these monsoons, I think, is really partially affecting that at least.
So when people are out and about, after a storm, where are these snakes usually?
Yeah, so people can certainly be bitten like hiking on a trail.
Right.
That's certainly something we see, but even in some communities, people have been bitten in their homes while they're doing yard work or walking to the car. So they can be encountered there as well.
So whether you're at home or, in the yard or hiking, what kind of precautions should people take even when they're walking the dog?
Yeah. So, especially if it's dark out, be really aware of where you're placing your feet. Maybe try to do some of these activities perhaps more during the day when you can see a little better.
Yeah.
And then also just if you're in an area that has debris, wood piles or branches, places that snakes could be hiding, really be aware of those areas as well.
Well, and obviously, when you're talking about rattlesnakes, sometimes they're not rattling, right? So, what should people do when they encounter a snake?
Yeah, so if you see a snake, the best thing to do is to just give it space. If you can turn around and walk the other direction, that's best. If you can't, certainly giving as much space as you walk around as possible.
So let's just say you are bitten by the snake. What is the first thing you need to do?
Really, the first thing to do is really just to get to the hospital so you can be evaluated and see if you need anti-venom.
Okay, we've all heard, over the years, like you try to suck the venom out. That is such a myth, right?
That's correct. We don't want you to do anything like that, not sucking the wound. There's devices that are made that are really not helpful and in fact potentially harmful. No tourniquets, nothing.
Nothing.
Yeah.
Don't cover it, don't try to wrap it, even loosely, nothing. Just get to the hospital. What are some of the biggest mistakes that people do?
Those are some of the biggest ones. Using these devices or putting a tourniquet on can really be damaging, cause more tissue damage there if you put a tourniquet on. Or sometimes waiting and not coming to health care. That's also something that people do.
Yeah, because time is of the essence. What kind of symptoms can develop?
So typically with rattlesnake bites that we have here, symptoms are usually swelling and bruising. That's what people will notice. And of course, pain.
Right. I'm sure a lot of pain. I'm wondering, are kids and pets more susceptible to these symptoms or is it, all the same between adults and kids?
For adults and kids, we really treat them pretty similarly. We dose the antivenom no differently. They can have smaller, extremities, and so maybe a little bit more swelling and tissue damage potentially can occur there. But we treat them pretty similarly.
Yeah, I bet. Okay, when should people contact the Poison Center?
After a snake bite, if you are concerned you might have a snake bite, you're not even sure, you can contact the Poison Center. Absolutely. If they can help you decide what happens. It's not uncommon. Well, it's uncommon, but it's not unheard of that people actually don't even see the snake sometimes, and they're not sure what they are struck by or bitten by.
Yeah.
So calling the Poison Center can help kind of navigate that.
Yeah, because sometimes you were saying earlier you can have a dry bite, right? Explain that.
So it's more common that snakes do inject venom, but sometimes they can strike you but not actually inject venom, and we call that a dry bite. But we still would want you to come to the hospital so we can monitor you.
Yeah.
Because even if you don't have a lot of swelling, you can still have some of the clotting abnormalities that can happen with snake
All
bites.
right. Okay, Dr. Spires, thank you so much for that valuable information. Don't forget the Banner Poison and Drug Information Center is available around the clock. The phone number is 1-800-222-1222. And if you are bitten by a rattlesnake, call 911. And again, just as Dr. Spires said, get to a hospital as soon as possible. Thank you again. Crystal?